Welcome back to Medical Neuroscience, and welcome to this tutorial on eye movements. It's a beautiful day in central North Carolina. It's a bit breezy, so if you hear the wind blowing in the background, maybe the wind chimes behind me, or maybe a little microphone pickup of the wind, I hope you'll pardon that. I'll try to minimize that as best I can. But otherwise, I'm really pleased to be addressing you in such a beautiful day on the topic of eye movements. So this topic pertains to two of our core concepts in the field of neuroscience. Once again, the brain is the body's most complex organ. And secondly, what we encounter again is a discussion of circuitry. That circuitry is largely genetically determined, and it provides the foundation for function in the nervous system. And for this tutorial, the function of interest is how is it that we can manage to keep our eyes focused on a visual target of interest? Or, if the case may be, how might we switch our focus to some new target? Well, that gets us into our learning objectives for this session. What I want you to be able to do is to discuss the 5 major types of eye movements and indicate the function and purpose of each. I want you to be able to discuss the neural circuits that are responsible for making saccadic eye movements, and I want you to be able to discuss the roles of the relevant parts of the brain that are involved in governing these eye movements. And we'll focus on 2 brain regions in particular: the frontal eye fields, which is part of the premotor cortex in the posterior part of the frontal lobe, and the superior colliculus, which is on the dorsal aspect of the midbrain. Well, let's begin by talking in very broad terms about the goal of making eye movements. Well, the usual goal is to adjust fixation. Now, remember from our studies of the retina and visual pathways that what we actually look at closely with high visual acuity is a fairly small region of the visual world. In fact, if I were to extend my thumb at arm's length, the width of my thumb is roughly that portion of visual angle that's actually seen well by the macula, and at the center of the macula, the fovea. So the challenge in observing our visual world with detail is to maintain our eyes on a visual target, even if that target is moving or if our head happens to move. So eye movements adjust fixation when the visual target of interest happens to be moving, such as maybe watching a bird fly across your field of view. And eye movements help to adjust fixation when our head is moving. So this is sort of the complementary scenario where we want to focus on a stationary object, let's say, and our head is moving, or maybe our entire body is moving. And so we want to make minute adjustments in order to maintain fixation so that central 1 to 2 degrees or so of visual angle continues to project on that part of the retina that's most sensitive for high visual acuity. Now, sometimes we actually want to break fixation. We want to acquire a new visual target. For example, all of you probably have a clock somewhere nearby. Go ahead and look at the clock and see what time it is. Well, that act of acquiring the view of your clock, wherever it may be, on your computer screen, a wristwatch strapped to your arm, or maybe on your phone that happens to be nearby, or maybe a clock on the wall, all of that required some change in visual fixation. So that's yet a very specific kind of eye movement that we want to try to understand, and we want to be able to discuss the circuitry that's necessary for making these kinds of eye movements in order to acquire a new visual target. Okay, well, how do eye movements occur? Well, in one sense, eye movements are remarkably simple, but they also give us an exquisite opportunity to gain some insight as to how the nervous system governs not just eye movements, but all kinds of movements. So the way in which they're simple is that the eye movements are controlled by 6 pairs of extraocular muscles. And here they are illustrated in this figure. There are the superior rectus muscles, which elevate the eye. There are the inferior rectus muscles that depress the eye. There are lateral rectus muscles that abduct the eye, that's abduct the eye. which means move the eye towards the lateral side. And then there are medial rectus muscles that adduct, that is, adduct the eye, move the eye towards the midline. Okay, so these four muscles work more or less in a Cartesian manner, pulling the eye along one standard axis of orientation or another. Well, in addition to the rectus muscles, we have two oblique muscles. There are superior oblique muscles that turn the eye downward and inward, and then there are inferior oblique muscles that rotate the eye outward and upward. Well, these 6 pairs of extraocular muscles are innervated by 3 pairs of cranial nerves. 2 of the nerves do just one muscle each, and then the third nerve does the remaining 4. So let's begin from the caudal end of the brainstem, and I'll remind you that our abducens nucleus, a somatic motor nucleus, along the dorsal margin of the tegmentum near the midline of the caudal pons, grows out a axon from its motor neurons, and that axon innervates the lateral rectus muscle. So that's easy to remember, right? The abducens nucleus abducts the eye, pulls the eye to the lateral side via the action of the lateral rectus. Okay? Well, next we have the trochlear nucleus. The trochlear nucleus, also a somatic motor nucleus. It sits along the dorsal midline of the tegmentum, now the upper part of the pons, or the caudal part of the midbrain, sort of where those two embryonic divisions come together. Well, these axons do something quite remarkable. They grow their axons towards the dorsal margin of the brainstem, which is unlike any other motor neuron we have in our body. All the other motor axons exit the brainstem on the ventral aspect of the brainstem or the spinal cord, if we want to extend the discussion to our alpha motor neurons of the ventral horn. The trochlear nucleus, on the other hand, has these alpha motor neurons that exit the dorsal aspect of the brainstem, and then they do something equally remarkable. They grow an axon that crosses the midline. I hope you've understood, perhaps from some Unit 1 sessions that we've had together, that all of the alpha motor neurons, except for these trochlear motor neurons, supply ipsilateral muscles. Okay, so the trochlear motor nucleus is a real oddball. Not only do the axons exit the dorsal aspect of the brainstem, but they supply contralateral muscle. Okay, so the abducens nucleus innervates the lateral rectus. The trochlear nucleus innervates the contralateral superior oblique muscle. All the other pairs of extraocular muscles are supplied by our ocular motor nuclei, with the ocular motor nucleus on one side of the midbrain. Here's our ocular motor nucleus, supplies innervation to the inferior rectus, the inferior oblique, the medial rectus, and the superior rectus, all on the same side as the nerve. Okay? So the third cranial nerve supplies ipsilateral extraocular muscles. Now I'll just remind you that there are a couple of other components of that third nerve I want you to keep in mind. One is the parasympathetic component that supplies the constrictor muscles of the iris. Remember, that's derived from the Edinger-Westphal nucleus. Those axons also run in this third cranial nerve. And also in the third cranial nerve are the axons of other alpha motor neurons that are involved in opening the eye, especially when we want to do so forcefully. Okay? So that's another set of alpha motor neurons in addition to those that supply these 4 extraocular muscles in the orbit. Okay, so now that you know something about the extraocular muscles and the innervation patterns, we're ready to talk about eye movements. And as I mentioned, there are 5 basic types of eye movements, and I'd like to just very briefly mention them, and then we'll consider each one in turn. Okay? So, broadly speaking, we make eye movements when the 2 eyes go in the same direction. These are called conjugate eye movements, and there are 4 kinds of conjugate eye movements. There are saccades, which are these very quick ballistic movements of our eyes. Again, if I give you the challenge of finding a clock in your environment and making an eye movement towards that clock, that's a saccade. It's a very quick, ballistic kind of eye movement. There are smooth pursuit eye movements, and these kinds of eye movements are what we might undergo if we wanted to follow the flight of a bird, for example, across the sky. It's slow, and it's typically guided by a visual target. There is another category of eye movements that we call optokinetic eye movements. And these eye movements sometimes involve a combination of smooth pursuit and saccadic eye movements. They're visually guided, and what they do is they are a response to large-scale movements in our visual environment. There are some other very subtle kinds of optokinetic eye movements that don't necessarily combine smooth pursuit and saccade, but what they all have in common is the visual stimulus being large-scale visual movement. The fourth type of conjugate eye movements we've already discussed in some detail. These would be the vestibulo-ocular movements, and these are the kinds of eye movements that are necessary to look straight ahead at you while I shake my head back and forth. Okay? We won't talk too much about vestibulo-ocular movements today, since we've already had a discussion about that, but I want you to know where to go back to learn more about vestibulo-ocular movements. So these are the four conjugate eye movements. There's also a category of eye movements where the two eyes don't actually go together. These are called disconjugate eye movements because the eyes move in opposite directions. And this is the kind of vergence eye movement that's necessary to focus on a distant object and then to a near object. So for example, I might ask you to hold your finger out in front of you and focus on that fingertip, and then focus at a distant sight, more or less in the same sight line but off at a distance, and then jump your fixation back and forth. Well, I doubt you can see what my eyes are doing, but I know what they are doing. As I go to focus on a distant target, the eyes rotate outward, and when I go to focus on the near target, my fingertip, my eyes rotate inward. So the eyes are moving in different directions. In order to go from outward to inward, the left globe needs to rotate in the adduction direction towards the midline, which would be a rotation to the right. The right eye has to also move in the adduction direction, but for that eye, it's a movement to the left. So the two eyes are actually rotating in different directions, but to serve a common functional goal. Okay, in this case, changing the line of fixation from a distant target to a near target. Okay, now let's talk about each of these 5 types of eye movements in turn, and then we'll spend just a little bit of time on the circuitry that's important for a couple of these eye movements. And we'll begin with saccades. So, a saccade is a quick, ballistic eye movement that allows us to change fixation from one target to another. And in the graph here, we see an illustration of a couple of key points regarding saccadic eye movements. So imagine a visual target comes on in this position right here, and what we notice is that it takes a bit of time for us to generate the saccade. Typically about 200 milliseconds is necessary between the onset of the target and the onset of the eye movement that allows us to fixate that target. So the eye movement itself is a rather sudden, sharp movement where we change fixation from one position to another, and this allows us to acquire this target. And this 200 millisecond delay turns out to be rather important because let's say in the middle of this 200 millisecond period of time, some other target came on that we might choose to look at. What would happen is that we couldn't generate a new saccade until the completion of the previous saccade. So there would be another 200 millisecond delay before the acquisition of the next saccade target. So there seems to be a very quick and explosive execution of this type of eye movement that allows us to go from one fixation point to the next. And this is what we do all the time. When we're looking around at a visual scene, what we do is that we move our eyes from one location to the next. I would encourage you to jump on YouTube or some other video source and just explore what people have posted who study eye movements. And there's all kinds of examples that I could direct you to where people have now begun to track eye movements. And it's quite remarkable what people look at and how often one actually makes a change in fixation. For most of us, when we're just casually walking down the street or observing a sporting event, whatever we may be doing, we are changing our fixation about 2 to 3 times a second, which is really pretty remarkable. And what's equally remarkable is the idea that somehow, while we're moving our eyes all around these visual scenes at such a quick rate, our brains are generating this constant, stable visual construction of what this scene actually is that we're inspecting. We may be tracking motion within that scene, but there's a stable scene despite the ongoing saccadic movements of our eyes. Now, one feature of saccadic eye movements that I really do want you to demonstrate for yourself is that during this period of time, when our eyes are actually moving, maybe about 150 milliseconds of motion here in this particular example, and that's pretty typical for how long we're moving our eyes during a typical change in fixation, we are functionally blind during that time, at least with respect to our conscious visual perception. So during this interval of time, we don't actually process the motion that is otherwise streaming into our subcortical visual pathways. Now, at some level, we think that information is present in the cerebral cortex, but it's not integrated within our conscious perception of the visual scene. So here's how you can convince yourself of that. I want you to go to a place where there's a mirror in front of you and just pick out some imaginary spots on that mirror, not too far away from one another. Let's say within, maybe about 20 centimeters or so of one another, and just make fixations to one spot and then the other. You'll have to imagine those spots, or maybe you can actually put a little mark on the mirror so that you have a visual target to saccade toward and look at. And what I want you to try to do is to see if you can watch your own eyes move in that mirror. Well, if you're like me, if you're like most people, the best you'll do is just catch a fleeting glimpse of your own eyes move. And this is demonstration of the fact that all of this visual blur that we might anticipate during the motion of our eyes is actually suppressed from visual consciousness. And for this reason, it's really quite difficult to see your own eyes move. Now, if you happen to be with someone and that person's watching your eyes move, there'll be no doubt in your observer friend's mind that your eyes are actually darting about from one target to the next. And yet, when you try to appreciate that yourself, it's really quite a challenge. So why don't you go ahead and pause this tutorial and go find a mirror and try that for yourself. And when you come back, we'll move on and talk about the next kind of eye movement. Okay, well, how did that go? Did you see your eyes move? Were you surprised at how little perhaps you saw? Sounds like a great topic to kick to the discussion forum, so why don't we do that and see if we can generate some good discussion around what you observe during saccadic eye movements. Well, let's move on then and talk about smooth pursuit eye movements. Now, smooth pursuit eye movements typically require a visual target. It's really difficult to generate this without a visual target. You might want to try that in the presence of a friend who can actually watch your eyes move and perhaps give you some confirmation as to actually what you're doing. But try to just sweep your point of fixation across the sky as if you were watching a bird that doesn't actually exist. It's really difficult. What you'll probably do is make a series of short little saccadic eye movements rather than sweeping your eyes as if you were tracking an actual object. Well, I was recently taking a holiday with my family, and we happened to be seaside and surrounded by a variety of seagulls, and I couldn't help but to think about smooth pursuit eye movements on that occasion while I tried to track the movement of these birds through the crisp early spring air. And it just reminded me that in order to make smooth pursuit eye movements, one really does have to acquire a visual target. So this is typically how this goes. Some visual target is moving across the visual scene at some particular velocity, as indicated by these red lines here, with different velocities, as indicated by the slopes of the line. And if we were to decide to have a look at one of these objects that's moving, what would happen is that we would make a saccade to that target, very quick movement in about 200 milliseconds or less. And then once we acquire the target, then we can track very nicely the movements of that target without that kind of jerkiness that I tried to demonstrate with my finger just a moment ago. So this is what's called smooth pursuit, and because a visual target is necessary, the circuitry is going to be actually quite complex. It's going to involve processing in the visual parts of the cortex back in the occipital lobe, but it will also require activation of circuitry in the parietal lobe and in the frontal lobe that's involved in integrating the location of that visual target as it moves through space and generating the appropriate motor response. So we'll have a little bit more about that at the very end, but for now I just want you to appreciate the complexity of the smooth pursuit eye movement. It's actually much more complicated than it may at first appear. Okay, so let's move on then and talk about the next type of eye movement, the optokinetic movements. Now, optokinetic movements come in different forms and different varieties, and here's one example of an optokinetic movement. Imagine that you're standing at a railroad crossing, as I often am, and a train goes by. And that train generates a very distinct pattern of linear motion from one side to the next. And so there are various elements of that train, vertical features, for example, that are passing in one direction or the other through your visual field. It's really difficult not to be grabbed by that visual stimulus. And what happens? Well, what happens is that we tend to make a saccadic eye movement to some feature on that train. Maybe it's a window in a coach car, or maybe a door on a box car. And then as that object passes in front of us, we essentially make a smooth pursuit eye movement. But very quickly, our eyes reach the limit of excursion in the orbit, and it causes us to make a quick saccadic-like movement where we reset and acquire the next object that allows us to track using our smooth pursuit system. Well, again, our eyes reach the limit of their movement in the orbit, and we make another saccadic eye movement back. So this sort of sawtooth pattern is very characteristic of optokinetic nystagmus. You may remember this word, nystagmus. We talked about it when we considered the vestibular system. It has to do with a nodding. That's what this word means, a nodding, as if we're falling asleep. So there's a slow movement, and then there's a quick reflexive movement in the opposite direction. Well, just as we had a vestibular nystagmus that could be an indication of the fact that we may have been recently spinning, or there may actually be dysfunction in the vestibular system, so we can have an nystagmus without movement of our head, being driven entirely by the movements of the visual scene. So this is why this is called optokinetic nystagmus, to be distinguished from vestibular nystagmus. So the stimulus here is visual. It's the large-scale movement of the visual scene. Now, not all optokinetic movements are nystagmic. That is, they don't always involve this slow and then rapid, fast resetting. Sometimes optokinetic movements can simply help to stabilize our vision when there is extremely slow drift in the visual scene. Well, in fact, we'll get to vestibulo-ocular motions in just a moment. The optokinetic system works in a very complementary way to the vestibulo-ocular system in order to stabilize our fixation. So this graph here simply shows us the gain of the optokinetic system and the vestibulo-ocular system across motion frequencies. And what we find is that for the optokinetic system, the gain is quite high when the motion is quite slow. So this is a very slow movement, and the optokinetic system helps to stabilize our gaze when there's very slow drift in the visual field. Maybe that drift is because our eyes are moving ever so slightly, or it's because the visual world is moving ever so slightly. Well, as the rate of movement begins to increase, then our optokinetic system can no longer keep pace. And that's okay, because our vestibulo-ocular system now kicks in. So once we are approaching movements at still a fairly moderate pace, nothing terribly quick about them, then our vestibulo-ocular reflex can maintain fixation control while there is motion, in this case at the head. So these two systems work in a complementary fashion. At very low rates of change, our optokinetic system maintains fixation. At high rates of change, as our head is moving, then our vestibulo-ocular reflex will help maintain our fixation through conjugate eye movement. Well, that does bring us to a brief mention again of the vestibulo-ocular reflex. I'll just again point you back to our tutorial on the vestibular system if you want to know more or refresh yourself about the vestibulo-ocular reflex. It's detailed here in this figure from chapter 14. I'll just remind you that the whole purpose here is to maintain fixation as we move our head. And so I'm trying to maintain fixation now at the camera while my head goes back and forth. And as I move my head to the left, my eyes rotate to the right. And the reason why is that as I turn my head to the left, I'm activating the horizontal canal on the left side of my head. That's driving excitatory signals that are going to cross the midline. That's going to activate the motor neurons in the rhodesians nucleus, which will innervate the lateral rectus and pull that eye toward the right. Meanwhile, there are internuclear interneurons that will project from one abducens nucleus to the contralateral oculomotor nucleus, and then that will drive the contraction of the medial rectus muscle in the other eye to produce a synergistic rotation of both eyes in a conjugate fashion, exactly opposite to the motion of the head. So the head goes to the left, the eyes go to the right. Okay, so I think we're ready to move on from considering our conjugate eye movements to a discussion of our disconjugate eye movements. And what we have in mind here are called vergence eye movements, and there are two varieties of vergence eye movements. There's convergence and then there's divergence. So imagine the situation where you are changing your fixation from some point at some distance away from you towards a near point. So maybe you're looking off in the distance and you decide now to hold up your finger and look at what might be on the end of your finger. When you do that, you're changing fixation from, let's call it point B to point A. And such a change in fixation is going to involve a rightward rotation of your left eye and a leftward rotation of your right eye. So both eyes are in adduction. And so this is activity that's driven by the oculomotor nerve, causing contraction of the medial rectus muscles in both orbits. And so that's what's necessary to go to a near point of fixation. Now, if one was going to go from that near point of fixation to a distant target, divergence is necessary. So divergence is going to cause the left eye to rotate to the left and the right eye to rotate to the right. This will bring our point of fixation from point A out to some distant target, point C. Okay, so going from near to far involves divergence. So you can imagine that there is likely to be a different kind of circuitry involved with different kinds of internuclear connections that allow for the coordination of the activation of the medial rectus and lateral rectus muscles as we go from a near target to a far target. So how are such movements organized by the nervous system? Well, we won't answer in depth for all kinds of eye movements, but I do want to give you a bit of a feel for the organization of circuitry that helps to coordinate the output of our brainstem ocular motor nuclei to govern these 6 pairs of extraocular muscles. And I want us to consider really 2 aspects of the challenge of moving our eyes. One is to produce the correct amplitude of movement, and the other to move the eyes in the appropriate direction for whatever the challenge might be. So concerning amplitude, the amplitude of movement of the eyes is encoded in the rate and duration of activity in the appropriate alpha motor neurons. So this is illustrated in the panel here to the left. So imagine that we want to shift our eye position from, let's say, more or less straight in front of us, off to the left. Well, for the left eye, let's call this the left eye, that's going to require activation of our lateral rectus muscle. So the lateral rectus muscle is going to contract, and that's going to allow the eye to rotate towards the left, or to abduct, Okay, so now if we are recording from the alpha motor neurons that innervate that lateral rectus muscle, what we find is that these motor neurons start firing action potentials just as we're beginning to actually contract that lateral rectus muscle. And very soon after the onset of contraction, within just a few milliseconds, there is an adjustment in eye position. Now, if we're just making a very small deviation from our neutral resting position, then that motor neuron might go quiet again. But if we want to continue to move further and further out to our left, we will need to induce another burst of action potentials in this abducens motor neuron. That's going to cause this eye to deviate even further. And now if we get beyond some critical distance where we actually need to pull our eye in order to keep fixation at that particular angle relative to the neutral position of our orbit, there may be some ongoing activity in that abducens motor neuron. Let's say we now make a far extreme eye movement, abduction, moving our eye out far to the left. Now another barrage of action potentials is needed, but so will a higher rate of sustained activity in order to keep that eye pulled off to the left. We need to contract that lateral rectus muscle in order to prevent the eye from being pulled back or relaxing back to its neutral position. Now notice what happens if we were to make an eye movement back in the opposite direction, in the direction of adduction towards the midline. This abducens motor nucleus neuron will go silent during that period, and this reflects the activity of some kind of interneuron that will suppress the activity of this abducens alpha motor neuron. In this way, the signals that are coordinated between the motor neurons that adduct the eye and abduct the eye can be coordinated, and they can work in synergy with one another. So when the eye is adducted, the abducens neurons fall silent, and vice versa for the ocular motor neurons that innervate the medial rectus muscle. Now, what about direction of movement? Well, direction of movement can be a challenge in various ways because objects of interest that we might want to look at can happen really in any position relative to our head in our frame of reference. So we need the ability to integrate signals that will allow us to direct our eyes towards any location in the visual world. And so part of the solution to this challenge of directing our gaze at an object of interest has to do with the biomechanics of the extraocular muscles. So we have these 6 pairs of extraocular muscles that have particular actions. They rotate the eye around particular axes of rotation. Part of this challenge is solved by simply coordinating the appropriate pairs of extraocular muscles. So the direction of motion, then, is specified by which pairs of extraocular muscles are activated. These muscles are coordinated by circuits of interneurons that are found in the core of the brainstem, in this structure that we've been talking about from time to time as the brainstem reticular formation. Well, as I've said elsewhere, the reticular formation really isn't one structure. It's really a large collection of circuits. And there are a couple of circuits that I would highlight here. And these are circuits that coordinate the horizontal movements of the eyes and the vertical movements of the eyes. And what's illustrated in figure 20.8 is the circuitry that coordinates the horizontal movements of the eyes. And that circuitry in the reticular formation is known as the PPRF, and that stands for paramedian pontine reticular formation. And one way to think about this circuit is a set of interneurons that are integrating signals that may be command signals from other motor structures, or they may be sensory signals. And the output of this circuitry of interneurons is to coordinate the appropriate firing of abducens motor nucleus neurons and oculomotor nucleus neurons that govern the lateral and medial rectus muscles respectively, so that our eyes can move in a conjugate fashion along the horizon. Okay, well, suppose I want to look off to my right. Imagine I'm just going to look to see if someone's over there, or maybe to see what time it is on a clock on the wall. That's going to require the abduction of the right eye, moving out laterally away from the midline, and the adduction or the adduction of the left eye. For the right eye, the lateral rectus muscle needs to contract, and for the left eye, the medial rectus muscle needs to contract. Well, here's the circuitry in the brainstem that makes this possible. I want to look towards the right, so there are circuits in this right paramedian pontine reticular formation that will drive the output from the right abducens nucleus, and that's going to cause the contraction of the right lateral rectus muscle. There will also be an internuclear neuron that will cross the midline and supply the appropriate alpha motor neuron in the contralateral ocular motor nucleus. That motor neuron then will fire away and cause contraction of the left medial rectus, allowing me to turn both eyes to the right in a conjugate way. So again, this paramedian pontine reticular formation is what we call the horizontal gaze center. Now, not illustrated here is another gaze center that's actually present up here in the midbrain, and it's a gaze center that coordinates vertical eye movements, okay? And we simply call this the vertical gaze center. And like the paramedian pontine reticular formation, the vertical gaze center is a network of interneurons that will coordinate the output of the appropriate motor neurons in the oculomotor nuclei that are governing the superior and inferior rectus muscles. And there's probably also some input to the trochlear nuclei to govern the superior oblique, as well as to the alpha motor neurons in the oculomotor complex that govern the inferior oblique muscles. Those 4 pairs of muscles together are responsible for moving the eyes upward and downward. Well, now as we come towards the conclusion of this tutorial on eye movements, I do want to take just a few minutes to talk about the circuitry that's responsible for generating saccadic eye movements. Now, I won't go into the circuitry for smooth pursuit. It's quite complex and involves essentially all of our visual and visual motor centers that we know about in the brain. And there's a figure towards the back of chapter 20 in the textbook that will lay all that out for you if you're interested. But rather, I think I'll limit our scope and focus on the upper motor neuronal control of saccadic eye movement. Well, there are essentially 2 principal parts of the brain that are involved in generating the command signals that are then conveyed into those gaze centers in the reticular formation of the brainstem. And at that level, we can consider that to be the level of our lower motor neurons that are coordinating the output from our alpha motor neurons that actually execute the movement. So I want to back up just a bit and consider the upper motor neuronal control of these saccadic eye movements. And so the two main stations that are relevant for controlling saccades from the perspective of upper motor neurons are the frontal eye fields, which are part of the premotor cortex, and the superior colliculus, which is on the dorsal aspect of the midbrain. Okay, so what these two structures do is that they begin to fire just before the generation of a saccadic eye movement. And that timing suggests that they have a role to play in generating the command signals about what kind of saccade to make, both in terms of the amplitude of the movement as well as the direction. Well, what we find in both the frontal eye field and the superior colliculus is a motor map. Now, this motor map for generating saccadic eye movements is informed by sensory maps that are present in both of these structures, and that sensory map represents locations in the contralateral visual hemifield, such that if one were to record from neurons in the frontal eye field or the superior colliculus, one could define a receptive field that would be present somewhere off in the contralateral visual world. If one were then to stimulate the same site from which you would record, what would happen is that the animal or the person would generate a saccadic eye movement to precisely the location of the receptive field of that column of neurons that were just sampled. So this is illustrated in the following figure concerning the superior colliculus. So what we have over here to the left is an illustration of the superior colliculi. So here's the left colliculus and the right colliculus. And what is shown in the left part of this figure is the sensory map. So there is an indication of the vertical meridian here. So here's the vertical meridian in blue. And in red and black, we have the horizontal meridian extending away from the midline into the right visual field. That is represented here in the left superior colliculus. And then in black, what we have is the horizontal meridian that extends off to the left. And so that horizontal meridian on the left side of the visual midline is represented in the right superior colliculus. And if one were to make a recording from different locations in the left and right superior colliculi, one can define a visual receptive field. And that's what's been done for these sites labeled 1 through 8. And these visual receptive fields are indicated by these white regions in the plot here to the right. So each white region is roughly where the receptive field is located in the visual world for each of the recording sites in the two superior colliculi. Well, if that same site in the superior colliculus is stimulated, what happens is that we would make a saccadic eye movement to the center of that visual receptive field. And this implies that there's some kind of registration between sensory map of the world and the map for saccadic eye movements. Now, one might imagine that this registration of a sensory map and a motor map for movement is simply a direct translation of the sensory frame into a motor frame for moving within that sensory world. But we know that our motor systems work in a more complicated way, that what's encoded is not simply some kind of Cartesian frame for movement, but rather really the intention for the movement, or what we sometimes call the motor error, meaning the movement that's necessary in order to achieve the goal. And in the case of saccades, that goal is to acquire a new fixation target. Well, here's an experiment that illustrates some of these points. And I think it's quite interesting, so I hope you'll hang with me and just think with me about this experimental result for just a few moments. So the experiment involves an awake animal model, a monkey that has an electrode implanted in the superior colliculus. And the monkey's goal is to maintain fixation on a central target And meanwhile, some kind of light is going to go on, and this we'll call the target light, T, here. And so the monkey is still maintaining fixation here, but it knows that it's going to have to make a saccade to acquire this new target at this location indicated by T. So this would suggest then that the monkey simply needs to look up. Okay? Well, here's the experiment. And a very clever experiment done by David Sparks and his colleagues. This experiment involves stimulating a site in the superior colliculus during this hold phase, while the monkey is fixating straight ahead, but now being cued to make an upward eye movement. And stimulation of that site in the colliculus causes a shift in the monkey's actual point of fixation. And so this shift now changes the fixation point to a new target here. And so the question is, well, what's going to happen when the monkey actually makes the saccade to the location of the target? If the motor map is being worked out in sensory coordinates, then one might imagine that the saccade that the monkey actually makes is according to a retinotopic-based framework of simply moving up, because after all, that's where the sensory stimulus was presented to the animal, up along the vertical midline. However, if there's some more complex integration of position of the eyes in the orbit, remembering the location of the visual cue to which a saccade must be made, then perhaps the monkey will actually make a saccade back to the original location of the target T. So what's going to happen? Is the colliculus employing a strategy that simply transposes a retinotopic map into motor output, or is there some more complex kind of integration involved? Well, the result to this experiment was unambiguous. What the monkey did was it made a saccade to the location of the target T, even though its eye position was shifted by this devious experimenter that stimulated a particular site just when the monkey was getting ready to make the saccade that shifted the position. So the monkey's eyes first were driven to a new position by the experimenter, and then the monkey made what we might call a compensatory saccade, bringing its eyes to the location of the remembered target. So this experiment really provided great evidence that the way that saccadic movement is organized in the output layers of the superior colliculus is not by simply receiving a sensory framework in retinotopic coordinates, but rather the output of the superior colliculus reflects a map of motor error. That is, a map of the movement that's necessary to achieve the functional goal, in this case of fixating a remembered target even if the position of the eyes in the orbit had been changed following the acquisition of that target. I'd like to make just a few other points about the superior colliculus before we move on to the frontal eye fields, and that is that the superior colliculus receives input not just from the visual system, but also from the auditory system and from the somatic sensory system. So what the superior colliculus really wants to do is direct our gaze towards a novel stimulus, a stimulus that captures our interest or our attention, not because we decided to look in that direction, but rather because the stimulus presented itself. So that stimulus could be a visual stimulus, it could be a sound that happens to be off in a direction that might cause us to look in that direction. Maybe it's a somatic sensory stimulus. Perhaps you're just lounging outdoors and you feel something crawling across your bare foot. Well, maybe it's an insect, maybe it's your pet dog or whatever, but it's an unexpected stimulus that causes you to look in that direction. So that involves a shift in the direction of gaze with a rotation of the eyes. It may also involve a movement of the head and the neck. And recall there are output pathways from the superior colliculus that are directed down towards the spinal cord. We think that they probably operate through reticulospinal connections, but there may actually be a direct projection from the superior colliculus to the upper cervical segments of the spinal cord that mediates this movement of head and neck that allows us to change our visual fixation from one location to another, being driven by a sensory stimulus. Okay, well, let's talk now about the frontal eye fields. So the frontal eye fields are a region here in the anterior part of the premotor cortex, in the posterior part of the superior frontal and middle frontal gyri. So they're probably just outside of the precentral gyrus in a region that we call Brodmann's area 8. Now there's some concern as to whether the frontal eye fields that have been described in non-human primates are exactly in the location that we would predict in the human brain based on these non-human primate studies. But I think this is a somewhat controversial question. Don't be surprised if some might say that the frontal eye fields are actually in Brodmann's area 6, which is what we usually associate with the premotor cortex. But the non-human primate literature would put it just a bit more anterior in what we call Brodmann's area 8, which is localized right about here in the anterior part of the premotor cortex. So the frontal eye fields are important in directing our gaze towards a visual target that we actually choose to look at. So we make a decision, we generate a motion plan, which is common to what is going on in the premotor cortex, and then we execute that plan. And the execution of the plan involves descending projections from the frontal eye fields to the ipsilateral superior colliculus and to the contralateral gaze centers of the reticular formation. The paramedian pontine reticular formation in the pons for horizontal movement, and a vertical gaze center in the midbrain or the mesencephalon for making vertical eye movements. Now, the fact that the frontal eye fields projects to both the superior colliculus and the gaze centers in the brainstem suggests that there may be some redundancy to the means by which circuits of upper motor neurons control eye movements. And in fact, that may be the case. What we know from studying animal models and even from studying clinical patients is that damage to either the superior colliculus or the frontal eye fields can result in a deficit in saccadic eye movements. But over some period of time, typically a couple of months, that deficit seems to go away, and saccadic eye movements are now relatively normal. And so it appears as though this redundancy allows the function of one structure to be compensated for by the increased capacity of the other to direct the positions of our eyes in the orbit. But nevertheless, there is an important distinction that I want to make between the operation of the frontal eye field and the superior colliculus. Concerning the frontal eye field, I want you to think of the intentional saccade. That is, you actually intend to make a movement. I might ask you to look and see what time it is. And so you need to decide, okay, where is my nearest clock and where do I need to look in order to see what time it is? So you generate a shift of your gaze towards that new visual target. So that's a saccade that you intend to make. So that's a frontal eye field function, and the frontal eye field in one hemisphere is going to drive your gaze to the opposite side. So that's important to keep in mind if you're in a clinical setting and you're taking care of a patient that perhaps has had a stroke in this anterior part of the premotor cortex. You may notice that this patient doesn't generate a lot of voluntary eye movements across the midline to the side opposite the stroke. And that knowledge should inform you about how you approach that patient. Or it may help guide your interactions with perhaps friends and family that may be visiting that patient in the hospital or wherever the care setting happens to be. So just be aware that the frontal eye field is directing voluntary shifts of attention across the midline to the opposite side of the visual field. Now the superior colliculi, on the other hand, they generate what we sometimes call express saccades. So these are saccades that are stimulated by some kind of sensory stimulus that we don't expect. We're not necessarily planning to make that movement. For example, imagine that you're outside as I am and it's springtime, and one common phenomenon that we have in central North Carolina in the spring are thunderstorms. I don't think we're in for a thunderstorm today, but perhaps there might be. And it may be that the first sign of a thunderstorm that I would appreciate is a bolt of lightning that might catch my attention off to one side. So I'm not expecting that, it just happens, and my eye movement system just might be quick enough to make a saccadic eye movement in the direction of that lightning strike, to be able to catch just a glimpse of that striking visual object. Well, that's an example of an express saccade. I didn't intend to make it, but the sensory stimulus grabbed my attention and induced a reflexive shift of my gaze in the direction of that stimulus. Well, the same may be true if the first sensation concerning the impending thunderstorm was not the sight of a lightning bolt, but the sound of thunder. If there should be a thunderclap off in the distance, I may find myself turning eyes and head and neck in the direction of that auditory stimulus. So that would be an example of the auditory pathway providing input to the superior colliculus and generating the appropriate shift of eyes, head, and neck. Well, let me conclude by simply stating that, like all upper motor neuron systems, the frontal eye fields and the superior colliculus are subject to modulation via circuitry that runs through the basal ganglia and even through the cerebellum. In the basal ganglia, there are circuits that constitute their own functional stream that run through the caudate nucleus, and for the palatal portion of this circuit, the substantia nigra pars reticulata. And this circuit is important for modulating the expression of saccades. So in order to make a saccade, we need to disinhibit the superior colliculus, or disinhibit the thalamic connection to the frontal eye field, in the same way that we talked about the role of the basal ganglia in disinhibiting other aspects of movement. Well, you can imagine that if you've got a problem where there's insufficient inhibition coming out of the substantia nigra pars reticulata, we may be making eye movements all over the place because we can't control them. We can't suppress the unwanted movements. That very well may be the case should there be a problem in the circuitry of the substantia nigra pars reticulata. One might also have a Parkinsonian condition relative to the ability to generate spontaneous saccades. And unfortunately, that can be the case if there's insufficient dopamine operating in the circuitry of the head of the caudate nucleus. The cerebellum plays a role in modulating the output of these upper motor circuits. And sometimes those of us that have a prescription for glasses or contact lenses, we have to make a change. And that change in prescription strength may mandate some kind of adjustment in the gain of our sensory-mediated eye movement reflexes, like our vestibulo-ocular reflex. Perhaps you've gotten a new pair of glasses and your optometrist or ophthalmologist has said, now be careful going downstairs for a day or so until you get used to it. Well, what that practitioner is really saying is, give your cerebellar circuitry time to implement an adjustment that will allow the gain of your vestibulo-ocular reflex to now be properly matched to the magnification of the sensory world that's passing through your lenses. Well, it's a lot easier just to say, be careful on those stairs, but really what's going on here is that the cerebellum is adjusting the gain of the vestibulo-ocular reflex in order to make the appropriate amount of eye movement that's necessary to maintain fixation. And in the case of getting a new pair of glasses, the degree of magnification of that world may have been changed. Well, the basic point here is that the upper motor neurons that control eye movements in the frontal eye fields and in the superior colliculus are subject to modulation by circuits of the basal ganglia and the cerebellum, just like all the other upper motor neurons. And in fact, I think we've learned more about how all this works for the study of eye movements than we have for just about any other type of movement, which again demonstrates the value of knowing something about the eye movement system, whether you're a neuroscientist or a clinician. Eye movements are very important in helping us to diagnose neurological problems, and they're very instructive for understanding how sensory signals are turned into motor commands. Well, that's it for now. And if you're keeping pace in the order at which these videos are being presented to you, you'll know that we're almost done with Unit 4. And what comes next in our final installment in our consideration of motor control is a session on the visceral motor system, otherwise known as the autonomic nervous system. So I'll look forward to talking to you then. And otherwise, I hope you enjoy your studies. Thank you for your consistent efforts to date. I know it's been a long haul already, but we're almost done with Unit 4. We're almost done with our consideration of sensory and motor function. And that will give us a little breathing room as the course concludes, thinking about the changing brain across the lifespan and finally the basis of higher brain function and cognition. Okay, so continue to work hard and study well, and I look forward to interacting with you in the discussion forum.